Hi everyone, in this video I will be discussing issues residents face while in long-term care. The issues that I will be highlighting is the impact the initial change has on the resident, the vulnerability, lack of privacy, lack of cultural humility. Um, a lot of facilities are now understaffed and a payer source of payment while they during their stay. Right now I'm going to read you the Residents' Bill of Rights, and this policy was implemented to protect them from some of the issues for which I just read that I will be addressing in this PowerPoint. The right to freedom from abuse, mistreatment, and neglect, the right to freedom from physical restraints, the right to privacy, the right to accommodation of medical, physical, psychological, and social needs, the right to participate in resident and family groups, the right to be treated with dignity, the right to exercise self-determination, and the right to communicate freely. The impact of the initial change that has on a resident is very rough. According to NALEPA, nursing home placement residents, a change of represents a change of physical environment of the elderly person and a disruption of the family relationship. It is often traumatic for the resident and for the family. Now, these are some of the things for which residents worry about during the initial change, and this is how it impacts them. They feel a sense of loss of control of their life, adapting to a new environment, having people there for which they do not know, being separate from their family. Their family dynamic may be broken because a lot of the aging, they are, or should I say, a lot of older adults, they are the matriarch of their family. And they fear that if they are separated, that bond might be broken and that dynamic might end. They now require 24-hour supervision, which is something that they may not have had. And so a lot of older adults being placed in a long-term care facility basically means the end of life, which is how they interpret it. And they also fear the unknown and wonder if they are going to pretty much receive the same accommodations for which they were receiving at home, far as good food, clean towels, clean bedding, and just being comfortable. Also, vulnerability is another topic. A lot of the nursing home abuse reporting is extremely underrated. They do not report it as often as it happens. As we know, older adults outside of children are the most targeted and vulnerable age groups. So here are some statistics for you to look at. That pretty much up to 33 of older adults who live in long-term care facilities will endure some form of abuse. Um, Another shocking statistic that I found is that more than 40% of nursing home residents have reported abuse, and more than 90% report that they or another resident of a facility have been neglected or abused. Another thing that a lot of residents face while in long-term care facilities is the lack of privacy. As you can see in this picture, the only thing that is separating two people in a room is a curtain. If there's an assessment or evaluation that needs to be done and your roommate is present, there is no privacy, unfortunately. Another point is cultural humility and cultural competence. A lot of long-term care facilities, they do not practice this as their values and as a goal. So, according to the NASW, section 1.05 of the Cultural Competence and Social Diversity, social workers should understand culture and its function in human behavior and society, recognizing the strengths that exist in all cultures. This is important because a lot of cultures, some people do not believe in medical interventions. Some people also do not believe in being resuscitated and having death with dignity of natural causes, meaning they do not want to be resuscitated and they want to be DNR. You also have a lot of facilities are now understaffed, which causes a lack of responsiveness. What may feel like a 25-minute, well, I'm sorry, what may seem like a 5-minute wait to you may definitely seem like 25 minutes to a half an hour wait for someone who has a weak bladder or incontinence. Um, Residents suffer, believe it or not, more than the workers, and burnout tends to occur within a lot of the nursing staff and CNAs, which happens for them to take it out on the residents. So the other topic is the payer source. A lot of residents I found in my experience with working in long-term care for several years and also reading some articles is that a lot of Medicaid payers versus private payers or private insurance payers, they actually pretty much get a second class treatment. It comes with a lot of rules and regulations for which a lot of these families are unaware of. However, what most older adults can only afford is Medicaid. To pay out of pocket is very expensive. It's about $200 to $300 a night for a bed. So right now I'm going to discuss the concrete steps to be used in practice to address the issues for which I just spoke about in residents for which residents face in long-term care. Always be mindful of the resident, put the resident's needs first, continue to practice cultural competence and sensitivity, follow and observe signs of abuse, build a professional client-worker relationship to build trust, provide empathy, learn your residents, and ensure all of their needs are met at all times. So the relevance to social work on a micro level is that simply this can possibly you one day, this can possibly be your loved one, your mother, your father, or a sibling. The individual suffers more than the workers do. Please keep that in mind. This allows social workers to work with families and residents to problem solve and implement correct interventions and goals and properly care plan. Also providing one-on-one services when needed, such as hospice. On a macro level, you have connection with insurance payers. This is how a lot of the social workers, nurses, and administration, this is how they get paid. A lot of the long-term care facilities, they implement outside contracts with different hospitals and different physicians' medical offices, along with dental, audiology, and cardiologists. Through the Medicaid and Medicare, this is how long-term care facilities, should I say, can afford to bring in outside physicians to allow them to be seen. A lot of long-term care facilities, they frown upon the resident bringing in their own facility from physician from the community. Um, Also, uh, advocacy organizations for abuse and family support systems. There is not enough of that. However, they do exist within the states. However, this is not being advertised as much as it should, and a lot of families do not know their options, nor they do not know their rights. A lot of staff working with residents in a long-term care facility, there is a lack of education. There's not many CEUs, there's not many trainings or anything, or especially for families, support groups who have families, loved ones that's in a long-term care facility. What are the steps that one should take? How should we proceed with this? So education for caring for a resident is definitely also on a macro level. I found this to be interesting in the NASW. I feel like this specific policy can go both with micro and level. It is the commitment to clients. Social workers' primary responsibility is to promote the well-being of clients, in general, clients' interests and primary. However, social workers' responsibility to the larger society or specific legal obligations may be on limited occasions. supersede the loyalty owed clients, and clients should be so advised. So the social justice issue for which I would like to spend a little time on is abuse in long-term care facilities. A lot. This is a very sensitive topic. Abuse in long-term care facilities is not reported as much as it should. There's not a lot of people are not knowledgeable about it. We don't know what's going on. A lot of people do not want to advocate for the older adult just simply because they might not be able to verbalize anything. And there also is not a lot of policies in place to protect our older adults from abuse. The federal policy for which I find to be the primary topic is the health care reform provisions. I'm sorry. So you have the community first choice option. It's a state plan option under the section 1915 of the Social Security Act. It states that the plan is to provide community-based services and supports to have a disability for those who have a disability who are Medicaid eligible requiring institutional level of care. Many people in long-term care are under the age of 60 and however also have a disability. This policy does apply and it protects them. You also have a policy that falls under long-term care specifically, um, and this is the Community Living Assistance Services and Supports Program, and this falls under the Healthcare Reform Act as well. It was, should I say, a new implemented national long-term care insurance program that was funded through voluntarily national payroll deductions. It provides cash benefits to older adults who are unable to do ADLs, which is activities of daily living, um, due to due to payment of the premiums by the enrollees who were the ones who was contributing their payroll deductions voluntarily. The program is set to reduce its deficit by 70 million within over the course of 10 years. The program is a state balancing incentive program. This is provided federal Medicaid matching to states which currently spend less than 50% of total expenditures for long-term care. Um, a lot of people do not know about these policies, unfortunately, and with the new healthcare reform, a lot of these policies are now being talked about being replaced. These are policies for which that can help. I feel as though these policies should be discussed in long-term care when admissions come. If there's a possible way to save a loved one from being in long-term care, there are options out there. However, people do not know. Honestly, I did not know about these options until doing research. Also, there is no policy coverage for planning for end of life under the Healthcare Reform Act. And I find this to be interesting because, a lot of people, they do go, when they go to long-term care facilities, unfortunately, the term for which they use is expire. I don't like that word. Sounds like a piece of meat or something. However, they use this term, and sadly, they do not plan for this. So this is where the life insurance policy have to come into play. Hopefully that, the resident and their family could find a good life insurance policy. However, I just find it appalling that there's no policy coverage at all for end of life. So here are my references. I hope you enjoyed my PowerPoint. If you have any questions, feel free to comment below. I look forward to the discussion. Thanks.